Proximal hamstring tendinopathy. It's a relatively uncommon cause of posterior thigh pain and maybe buttock pain. It can affect a variety of athletes, and it can affect active duty service members. In this video, I'll discuss the mechanism of injury, the signs and symptoms of the injury, diagnosis and treatment option for this hip and thigh condition. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Let's talk about what this is. Proximal hamstring tendinopathy. It's a relatively uncommon cause of thigh pain, pain in the back of the thigh. You see it in athletes, especially sprinters, but also long distance runners and some endurance athletes. But you also see it in the military due to a lot of that same endurance training and running training. It's typically a chronic degenerative condition that develops over a period of time due to an overload and repetitive stretch. There's a number of potential factors, overuse, which is why it may be common in military service members, but it can be weak hamstrings, it can be weak stabilizing muscles around the pelvis. Studies have shown it's largely due to, again, an overload on those proximal hamstring tendons right as it attaches to what's called the ischial tuberosity, or what a lot of people know as the sit bone. What you typically experience if you have tendinopathy of that proximal hamstring, the patient won't usually remember a specific event that started it. Typically, it's a gradual increase in pain in the posterior thigh. It might feel like tightness. It might feel like cramping deep in the buttock or deep in the upper back of the thigh, close to that sit bone. You can diagnose it by, really the only great way to do it is by MRI. And what you'll see on MRI is an increased signal on certain forms, the T2 images specifically, right around the origin of the hamstring tendon as it comes off that ischial tuberosity. Treatment is almost always non-surgical, and it usually works. It's things like eccentric exercises and physical therapy, soft tissue mobilization, sometimes shockwave therapy. Some people use corticosteroid injections like cortisone. I think that's a terrible idea because I think it weakens the tendon, but that is out there. Platelet-rich plasma is something that is often done as well. What I typically see, both with patients and with military veterans, you've got to be careful because that will a lot of times show up on an MRI but not be the source of pain. But in somebody that has posterior thigh pain, doesn't have hip arthritis on the MRI, doesn't have groin pain, doesn't have a labral tear on MRI, but has posterior thigh pain and buttock pain, that can be the source of the issues. And again, it's usually related to overuse over a long period of time. The military is a great source of that. But an endurance athlete like a marathon runner or long distance runner, former sprinter, you might see that as well. Again, commonly seen on MRI. Whether or not that's the actual source of injury or pain or disability, that's a little trickier. Now, if you're interested in learning more about the disability claims process, I wrote an ebook that might be perfect for you. It's called The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. Yes, the title's a mouthful, but I think it's really helpful, and I've gotten a lot of great feedback. You can get it free by clicking the link in the description below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're ready to move forward and you're interested in a Nexus letter for your injury or condition, click that link in the description below and you'll learn more about working with me and working with my team. We do everything we can to make the process quick and easy, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks so much for watching, and I look forward to working with you.